Welcome back again to another show of the Community Health Education TV series in cable. As we all know, falls are very costly and serious. Recently, we have spoke with the seniors from the Chelsea Senior Center, and they were very concerned about the falls as well as the risk of falling. We have collected some of their questions, and today we have some of the providers from the MGH Chelsea Healthcare Center to share some information about this topic. First, let me introduce you Pep, who is the community health worker in the Community Health Improvement Team of MGH.
Hello everybody. Today we have a wonderful panel here to discuss falls. Let me introduce them. We have Sophia Divine, physical therapist at MGH Chelsea. We have Dr. Chen Chung, internal medicine doctor at MGH as well, Chelsea, and Jennifer Betry, our nutritionist. All right, let's start with a question for Dr. Chen. What causes falls?
Okay, let's start talking first some of the demographics or risk factors of fall. As we all know, falls are very common, especially in elderly people. It can go up to 30 to 40% for people that is older than 65 years old, and more than half in people that is over 80 years old. Some of the research have shown that the female, actually men and women, they all fall the same. However, women might have more injuries after a fall, and that is because of the most commonly known, the osteoporosis that women has, as well as like even one fall can make people limit their activity. So it would decrease the amount of activity that any person have. It would increase their fear of falling more. Up to half of the people, after they fall, they cannot get up, and actually they have more risk factors and actually worse health outcome than those people that are able to get up by themselves. People that have fall once are at increased risk of falling again. As again, we're saying that like a lot of older people suffer more of this, but also all the factors can influence in this, such as like we said about gender, they can get, the female people, women, get more health issues after falling, and elder people get more falls. All the physical conditions, such as if they have had a stroke, if they have arthritis, any pain that limit their movement, can increase the risk of falling. But not only physical, as well as mental issues such as distraction caused by depression or being worried too much about something else can cause more falling because they're not so much aware of their environment. The medical history, as we are talking about, any heart disease that make them feel dizzy or feeling palpitation, that they're very scared, that can make them fall. Any stroke that they have in the past, limiting their strength of the muscle, can cause fall, as well as any surgery that they have taken. As we know, also elderly people become to use more medication, and as we all know, all the medication can have some adverse effect, and some of the medication might increase the risk of falling for people.
Right, now an often asked question for Sophia. What are possible home obstacles that can lead to falling?
There are a number of home obstacles. For example, in stairways, not having good lighting can be a problem, and also having unsecure handrails or not having a handrail. So usually we recommend installing good lighting and securing the handrail or installing. In the bathroom, there's some hazards with slippery floors, wet floors, especially in the bath. Placing a non-skid rug or bath mat could be helpful. Also, having a grab bar is very helpful in the bath and also next to the toilet. In the kitchen, having items located too high or low can be a problem. So normally we recommend to place the items at chest level to make it easier. And if you do need to get objects that are pretty low, perhaps sit when you go obtain those items that are located low. In the bedroom, again, poor lighting could be a problem, especially in the middle of the night when you get up at night. Making sure that you have a lamp right next to your bed is important, and maybe consider having a night light. And lastly, in the living room and the hallways, scatter rugs can be a problem. People trip over the edges. So I usually recommend getting rid of those. And if you can't, then tape them down to the floor. And lastly, clutter makes a big problem. Any objects you can potentially fall on. You have to be careful with pets who run under foot. Sometimes that can be a problem as well.
Dr. Chen, does stress or mindlessness play a role in falling, and how?
Yes, so we were talking about the causes of fall, and I think that Sophia described very well all the external factors, like outside of ourselves, that can cause us to fall, and also Sophia mentioned wonderful tips to actually prevent, and that is a very important part. But then there's another part that's inside us, the kind of like the internal individual factors, and anything that can alter our awareness of our own body can increase fall. So when we're stressed, we're worrying about something else, we keep thinking about that instead of looking our way, not having enough light, but at the same time, even with the light, we're not looking our path, that can cause us to have accidents. So being aware of not only the environment, but of our body, how to balance ourselves. Sophia was mentioning that if you're trying to reach something that's really low, sit down. So be aware how far you can go down. That is the part of the mindfulness of being alert of ourselves. Beside that, also if you are feeling sick at that moment, like we're talking about triggering factor, meaning things that can worsen our situation of falling, or like when we're sick, we're very dizzy at that time already, we're really distracted, we have been very weak. Those are things that we have to be aware of ourselves. So the mindfulness, more like emphasizing that we have to understand what's our situation, and also keeping the best possible our environment to decrease the risk of falling.
Sophia, what drugs are good for home?
We usually recommend wall-to-wall rugs that are low pile.
And what kind of shoes are good for seniors to help prevent falls?
Shoes with low heels, with rubber soles. You want to make sure that they're well-fitting and they're secure. So if they're lace-up, you want to make sure they're laced all the way up. If they're Velcro, you want to make sure that they're tightly placed.
Now a question for Jennifer. What foods are good for bone health?
Well, along with a healthy diet, it's very important that people get enough calcium and vitamin D for healthy bones. Calcium is a mineral that our bodies need to build and maintain strong bones, and vitamin D helps our bodies to absorb calcium. Some foods that are rich in calcium include, we have some of them on this poster here, include dairy products like milk, yogurt, and cheese. Non-dairy sources of calcium include sardines and salmon with bones, as well as some green leafy vegetables like kale. Calcium is also added to many foods, and we call these foods fortified foods. And some examples of fortified foods include tofu, or fortified soy, rice, or almond milk, or fortified orange juice, and we have an orange there to represent the calcium fortified orange juice. Vitamin D is also found in some foods, and our bodies make vitamin D when we're exposed to the sun. Vitamin D deficiency is common, especially in colder climates, like here in Massachusetts, because we're not exposed to a lot of sun during winter months. Foods that have vitamin D, again, include sardines and salmon with bones, as well as mackerel, and then we have some foods that have vitamin D added to them, like milk.
See, now back to Sophia. How can we be more aware of our surroundings? Let's say like home risks, holes in the street.
Similar to what Dr. Chen spoke earlier, mindfulness is really important. So when you're going to walk, you want to scan the where you're going to be walking, check for holes, check for pets, check for ice, come up with a plan and walk around it. Again, poor lighting can play a part with vision. We use a lot of revision with balance. So perhaps consider going out during the day when there's better lighting, or look for areas that have better lighting. And if there's not good lighting, you may want to consider speaking to your city or town to install better lighting or fix better lighting.
Now, Dr. Chen, a question that is in most people's minds: what medicines can make you dizzy?
What medicine? First, dizziness, I think, is a term that a lot of people say, and really is hard with just saying that I'm dizzy. What does that really mean? And I suggest everyone that go to a doctor and say that I'm dizzy, try to describe better what does really dizziness mean. That can mean that actually you're having vertigo, which means that you feel the room is spinning around you. You can feel actually lightheadedness, that like you're fainting, or you feel unsteady, that your feet is weak, or sometimes that you feel the floor is moving, or like some sensation when you're in both. So dizziness needs to be described better to understand what is the real cause of that. And even sometimes confusion can be felt as like a dizziness. So a lot of things can cause dizziness, that include anything that can move your floor, of course, being distracted or being very sad, not having enough energy, being weak, not having enough food, like low sugar, anything can cause dizziness. So per se, what are the medication then that can cause dizziness? Then we'll mention exactly is that things that can make you confused or sleepy. That would include any medication that causes sleepiness, such as some of the allergy medication that we use, medication that we use for sleeping, even if it is over the counter. Things that will make your blood pressure go down. That means any blood pressure medication that for the high blood pressure. Things that make your sugar go down. That means diabetic medication can cause that. And things that can affect the nerve system, including the antidepressants or medication that helps for the anxiety. At the same time, that calm you down. Some people calming down needs to sleep, so get sleepy again. So any of those medications can cause, and also many other medications can cause that. I'm sorry. So that means that like if you have any change in medication that you feel that might be strong, you have to notify your doctor.
And then, how can medications affect balance?
Along the same way. So it's more like an interaction between medication and the condition that has the person, the external as well as the internal, the individual one. So any medication that I mentioned before that has caused the alteration of the nerve, the confusion, the sleepiness, at the same time pain medication, but also because the person per se has some pain that make them not be able to move in a certain way, can cause them to fall more and feeling more dizzy. And the medication that decrease our sensation of our body can then make us not be able to control our body and then cause some dizziness and therefore having the accident of falling.
So following up this, Sofia, what tips can you give us for safe walking?
First of all, I would recommend examining your eyes every year. Make sure your glasses are updated. Careful with walking with bifocals or progressive lenses. Be careful with slippery areas that have ice. Avoid it. You may want to consider carrying a bag of salt or sand or even kitty litter in your coat, or if you have a car, you can put it in your car, because you never know when you're out. You might need to sprinkle some down to kind of create a safer pathway to walk. Another recommendation is when you get up from bed, sit for a moment before getting up, just to make sure that the blood flow gets to the brain and so you don't feel dizzy when you get up. And lastly, actually a couple more things. If you feel unsteady, use a walker, use a cane. It's hard at first, but if you do use it, it prevents falls. And don't hesitate to use that. And if you live alone or you find that you are alone for a period of time, you may want to consider investing in the emergency response system for your home.
Jennifer, another question that we get very often, Do calcium supplements really work?
Yes, calcium supplements do work. Ideally, we want to try to get our nutrients from our diets, but sometimes this isn't possible, and if you find that you're not getting enough calcium in your diet, then a supplement can definitely help. There's different types of supplements. Two of the most common forms are called calcium carbonate and calcium citrate. Calcium carbonate is typically cheaper than calcium citrate, and it's recommended that if you're taking a calcium carbonate supplement that you take it along with food for best absorption. Calcium citrate can be taken at any time. There's also many different options in the stores, and what I recommend is that people look for a supplement that has both calcium and vitamin D in it for best absorption again. And seniors might find it easier to take a chewable form, and they should compare prices.
Sophia, what type of exercise is good for preventing falls?
Balance exercises are great to do. Any strengthening exercises for the legs are helpful. Also stretching exercises for the legs. And if you like classes, Tai Chi is a wonderful class that incorporates all of those type of exercises.
And then, so how much exercise do you recommend for seniors a day?
At least 30 to 60 minutes a day, most days of the week. And if you can't do it all at once, don't worry. You can do 15 minutes in the morning, 15 minutes in the afternoon, 15 minutes in the evening. All of it counts.
All right, now a question for Dr. Chen. How can we help a loved one or someone who is reluctant to use a cane?
To start with, I think that it's really hard for anyone to just kind of like go out with a cane. That like looks something symbolic for a lot of people that we're losing our own independence. So a lot of times it's not that they're really so bad. It's a team effort that would take this. We usually recommend physical therapists, but beyond that is like, as Sophia was mentioning that I didn't mention so much, is the eye health, like needing good way to be able to see well everything. And also because people are, after a fall, as I mentioned, they get more scared of falling, thus they decrease their activity. So it's very different between when a patient come in because they fell outside in the street compared with inside. That means that the person that is outside, actually they have better outcomes because they have kept their activity. They're still willing to try things out. And to help them to achieve, to continue to have these social activities, which is very important for health, I think that there's different aids, and give the choice for the patient. It's working together and respecting them, what they want to use, and how we can help on not only a cane, like, okay, you're falling, so get a cane, but it's like any other things that can help for that person. And if that person decides that the cane can help them to maintain their level and quality of life, I think that that would be more a personal choice as well as a support between all the people. Kind of like mention them and dignifying that they are doing this and improving their health.
Thank you very much. And now lastly, what final word of wisdom do you have for our viewers about falls and preventing falls?
As far as nutrition and diet, just that nutrition matters. It's important. It does play a role in the prevention of falls as well as your overall health.
It's important to stay active, do some exercises, and make a few changes to your home.
Yeah, I think that they both say, oh, I think a healthy lifestyle based on exercise and a good nutrition definitely help not only for falls but for the overall health. So we really need to pay attention, and these small things, not about only medication, it's not big step, but small step of exercising and eating well every day can help us. So take action now and let's stand in solid ground.
Thank you very much then. Thank you, Sophia. Thank you, Dr. Chen. Thank you, Jennifer. Thank you for your time and expertise. This has been very informative.